Hey guys, Alex Winder here from Blue Wave Insurance. Today we're going to talk about how to find the best Medicare plan for you. So the first step is you want to decide which plan type you're going to go with, either a Medicare supplement plan or a Medicare Advantage plan. So how do you decide? I'll give you some tips. So the way the plans work is Medicare Advantage will take over your Medicare and become primary. That means you'll have a network of doctors you have to stay within. And depending on the plan, whether it's an HMO or PPO, you may need referrals to see certain doctors. The Advantage plans do include drug coverage and a lot of times dental and vision, and usually the premium is $0 per month. So the Advantage plans can be very affordable. The Medicare Supplement plan, on the other hand, works alongside original Medicare and pays after Medicare pays. That means there's no networks. You can go to any doctor anywhere in the country that takes Medicare, no referrals needed, and the coverage is very good on those plans. The supplement plans, however, do not include drug coverage or dental or vision coverage. That has to be purchased separately. Also, the Medicare supplement plans usually range $100 or more per month for the plan, not including drug coverage or dental or vision. So there's a difference in premium, but the coverage is typically a lot more comprehensive than an Advantage plan. So once you've decided which plan type you're going to go with, you're probably wondering, how do I find the best plan? So let's start with Medicare supplement. Let's say you wanted to go with a Medicare supplement plan. You're going to need to decide which plan letter you're going to go with on the Medicare supplement. So it's either going to be a G or an N typically. Those are the most popular options. Plan G is the number one most popular plan because it's the most comprehensive. And then the second one is Plan N. The only differences between the two is that Plan N has copays, doesn't cover Part B excess charges, and Plan G does cover those items. So Plan G, no copayments, just has an annual deductible. And then Plan N has copayments, has the same deductible as G, and does not cover Part B excess charges. See my video in the link in the description regarding Plan G versus Plan N, where I do a deep dive on the coverage differences and the premium differences. So once you decide between Plan G and Plan N, you'll want to decide on a carrier. Now it's important to know that all the carriers offer the same plans with the same plan letters. For example, there's about 20 to 30 carriers offering Plan G in any given state, and the same with N. The only difference between the carriers is the price they charge. The benefits are the same between the carriers for the same plan letter. So it makes it easy to compare between the carriers. We're really just looking at price and then carrier stability, carrier rating. So we're going to want to go with a carrier that has a competitive rate and has an A rating. How do you find a competitive rate? One way to do it is to call each carrier individually and ask for their rates. The easier route is to give us a call. We can shop rates for you free of charge. Give us a call at the number below. We'd be glad to help you out shopping rates for Medicare supplement plans. So we've talked about how to find the best plan when it comes to supplements, if that's your route you want to take. If you want to go the Medicare Advantage route, there's a different way to go about that. So the Medicare Advantage plans have a lot of moving parts. They have provider networks, they have prescription coverage, so different formularies, what drugs they cover. So typically you'll need to find a Medicare Advantage plan that has your doctors in network and covers your drugs. So one way to do it is to go into medicare.gov, put in your zip code, and you can see all the Medicare Advantage plans available in your county, and then you can look at the plans and see which one looks best. The downside of that is medicare.gov does not have provider networks mapped into the website. So that means you have to go through each Advantage plan, go on their website, go through the providers, and find a plan that has your providers in network. So it can be a lengthy process. The easier route is to use a broker like us, where we can get on the phone with you, put your doctors, put your medications in the system, and we have software that populates the plans, and we can easily filter down and only show the plans that have your doctors and your medications covered. So it's really make it really easy for our clients, and we charge nothing. So give us a call if you're interested in comparing Advantage plans or supplement plans and finding the best plan for you. Now, the last plan we're going to talk about is Part D drug coverage. To compare drug plans, you can go onto medicare.gov, enter your zip code, enter your prescriptions, and see all the plans available and what they cover. That's one way to do it. The other way is to work with a broker. We do help our Medicare supplement clients with their Part D drug plans, but unfortunately, we don't do the drug plans on their own. And that's because the carriers just don't pay really any commission on the drug plans anymore. So it makes it really hard to sustain that and do it on its own. But we do help our clients who do supplement plans with us with their drug coverage. And then for our Advantage clients, already have the drug coverage embedded in their plans. That's part of the process when we compare options for them. So if you have questions, give us a call at the number below. We'd be glad to help you out. Don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.